Hello everyone. Thank you so much for joining us today where we will be discussing the relationship between obesity, insulin resistance, and laminitis in equines. In this video, we will discuss 5 key points. What is laminitis? What is the issue with obesity? What is insulin resistance and how can it develop? The link between obesity, insulin resistance, and laminitis, why we should care, and how to prevent these conditions.
Let's start with what laminitis is. This video shows the inside of the horse's hoof. Highlighted here is the hoof wall and the bone, which is often referred to as the coffin bone, pedal bone, or the distal phalanx bone. Throughout this video, we will refer to it as the coffin bone. Now zooming in between the hoof wall and the coffin bone, holding them together is the structural connective tissue called the laminae. Laminae on the coffin bone interlocks with the laminae on the hoof wall, acting like Velcro and attaching the two to each other. Laminitis is a condition where the laminae is inflamed. This causes the Velcro-like mechanism to no longer work, and the coffin bone separates from the hoof wall. Laminitis is a very painful condition for the horse. When the horse moves, pressure is applied to the inflamed laminae. This can cause the bone to rotate and/or sink, and the blood flow to the hoof can be constricted. Here, we can see a cross-section of a normal hoof that does not have laminitis, and the coffin bone is parallel against the hoof wall. This next photo shows the coffin bone sinking and pulling away from the hoof wall as the previous video depicted. In this picture, you can see the coffin bone is much closer to the sole of the foot than the non-laminitic foot, and in severe cases, it can penetrate out of the hoof. This last photo shows the coffin bone rotating within the hoof and away from the hoof wall, and you can see that this changes the shape of the outer hoof. Hopefully from these photos you can see how laminitis can be a painful and crippling disease. This video shows a horse with laminitis. You can see when this horse is beginning to walk, he shifts all his weight back to avoid putting pressure on the front limbs, which are in pain. This alters the way they walk and their gait, also known as lameness. You can see this horse is very reluctant to walk and may be putting more pressure on the unaffected limbs, which can cause damage to those limbs if this persists. Shifting weight, lameness, and reluctance to walk, trot, or run can be good indicators that your horse has laminitis. This picture depicts a horse shifting all its weight back, relieving pressure from the front 2 hooves, creating this tilted stance that is a trademark for laminitis. Typically, laminitis appears more severely in the front 2 hooves, but can still affect all 4. Before we talk about how laminitis is linked to obesity, let's explore what obesity is. An obese horse is a horse that has too much excess fat. There is a common misconception that skinny horses are neglected and abused, while a plump horse is happy and well-loved. Although they may be happy, they are definitely not healthy. When a horse has too much extra fat, this can cause a wide array of health concerns to develop. Medical professionals often call these health concerns metabolic disorders because it causes changes to the horse's metabolism. One metabolic disorder that commonly arises from obesity is insulin resistance. Excess fat causes inflammation within the body, which increases the risk of the horses developing insulin resistance. Insulin resistance can be a consequence of obesity, but can also be found in horses that are not obese. So what is insulin resistance? Insulin is a hormone that is created by the horse's body to help regulate blood sugar. Insulin resistance is when the horse becomes less sensitive to insulin and the body has trouble regulating its blood sugar levels, causing sugar to accumulate in the body. This causes the body to produce even more insulin because the body is trying to get rid of the sugar in the blood and thinks there is not enough insulin to do so. This causes inflammation within the body. Insulin resistance in horses is similar to type 2 diabetes in humans.
Before we explore how laminitis is linked to obesity and insulin resistance, let's quickly recap what we have discussed so far. Obesity causes inflammation in the body. This inflammation can kickstart insulin resistance in the body, which can lead to more inflammation. This is similar to type 2 diabetes in humans. But remember, like type 2 diabetes in humans, the horse does not have to be obese to acquire insulin resistance. Now let's dive into the mechanisms linking these diseases together. The inflammation caused by obesity and insulin resistance causes disturbances in the body, and the mechanisms that help maintain a healthy hoof can become disrupted. There are mechanisms that work together to constrict and dilate the blood vessels that allow blood to flow into and out of the hoof. However, insulin resistance can cause changes to these mechanisms and causes more constriction of the blood vessels than dilation, which cuts off the blood flow to the hoof. This can lead to tissue death, causing pain and discomfort to the horse. Additionally, when a horse is obese, it has to carry around more weight, which physically puts more pressure on the hoof, creating more pain and discomfort. Now that we know the basics of laminitis and how obesity and insulin resistance can lead to laminitis, let's talk about why it's important to prevent these diseases from occurring. Obesity, insulin resistance, and laminitis are all very damaging to a horse's body. Laminitis can become extremely painful and discomforting to the point where the horse is reluctant to get up and walk. This is a huge welfare issue, as the pain they experience from these diseases can limit their performance and restrict them from displaying their natural desires to move freely. Additionally, the effects of obesity are not limited to what we have discussed today. Obesity in horses can cause other metabolic disorders as well, so it is in the owner's best interest to prevent obesity or manage it as soon as possible. Lastly, laminitis is expensive to treat. It requires lifelong management and can become so severe that euthanasia is the only humane option. Owners can experience lots of emotional and financial stress from this diagnosis, which is why preventing laminitis before it happens is so important.
So what can we do to prevent laminitis? First, owners should regularly score their horse's body condition to see if they are underweight, overweight, or obese. The ideal body condition score ranges from a value of 4 to 6 depending on the horse's work level, breed, and stage of life. Endurance horses tend to be on the lower level, and young growing horses should be in between the score value of 4 and 5, as anything above a 6 can contribute to developmental issues in the future. The crusty neck score is another evaluation system owners can use to measure the fat buildup on the neck. A crusty neck can develop regardless of body condition score and is often a good indicator of insulin resistance. We have included a QR code here that leads to a user-friendly fact sheet that we've created. This fact sheet combines both the body condition score and the crusty neck score systems. As seen in this fact sheet, we can assess our horse's weight by looking at 6 regions: shoulder, neck, withers, ribs, loin, and tailhead. Each location, except for the neck, ranges from 1 to 9 to help us get the most accurate evaluation. The crusty neck score, however, ranges from 0 to 5. To prevent laminitis, we should majorly focus on the horse's neck. If your horse has a crusty neck score of 3 or above, there is a high chance your horse has insulin resistance and is at a greater risk for developing laminitis. If this is the case, please refer to our pamphlet and contact your veterinarian. Another equally important component in preventing obesity, insulin resistance, and laminitis is proper nutrition. When a diet is high in starch or sugars, it can lead to all of these conditions. Just like when humans have too many potatoes, pasta, bread, and candy, they can gain weight, develop obesity, and diabetes. Specifically in horses, obesity causes metabolic changes that increases the risk for laminitis. Diets high in starch and sugars have also been shown to reduce the sensitivity to insulin. For these reasons, owners should limit or even avoid grains such as oats, corn, and barley. Another thing owners should be aware of is the sugar content in grass. Owners should avoid letting their horses out on pasture, especially during the daytime or spring, as this is when sugar content is the highest. If owners want to allow their horses to graze, the best times would be early morning or at night. A third method in reducing sugar content in a horse's diet is by testing hay. By doing this, owners can ensure their hay contains less than 12% of non-structural carbohydrates on an as-fed basis. Horses with active laminitis or insulin resistance should be kept under 10% non-structural carbohydrates to limit further damage. We hope from this video you have gained a better understanding of laminitis, obesity, and insulin resistance and how they are linked to one another. With the knowledge you have learned, hopefully you can prevent these diseases from happening in your horse. Thank you for joining us today.